Welcome to Sable Chase Animal Clinic, and congratulations on your new kitten. And Joel has kindly volunteered his new kitten to show you what we mean by a complete physical exam for your new baby. Alright, so first of all, we make friends. And she's a sweetheart, so it's easy to do that. And while I'm making friends, I'm looking at how she responds to me. I'm watching how she looks. I'm watching how her eyes move. I'm watching how she's overall positioning herself in her space. And that's very important because some kittens have a disease called cerebellar hypoplasia, which is a condition where they can't orientate themselves in space properly. So what I'm seeing by the fact that she's interacting with me, she's engaging with me, she's actually noticing what I'm doing, she's curious, she's interested, this tells me that she does not have that condition, which is fantastic. So even in this short few moments, I've actually already learned something about her. Next thing we do is we look at her eyes. Now what I'm doing here, as I shine this light into her eye, I've got a special lens that allows me to illuminate the back of her eye, which is called the retina. And what I'm looking there is for any signs of retinal damage. Now that too can point towards various viral diseases that kittens can suffer from. If we see a nice clean shiny retina, that's basically something called the tapetum lucidum, which is what shines out when you shine a bright light in a cat's eyes. You'll actually see tiny little holes in it, sort of little dark areas, and that's a sign of a viral disease. We're not seeing this on her, so we're good to go to the next step. In shining the light in her eye, I also noticed that her pupils closed up. That shows that the retina is working. When you shine a bright eye in one eye and the other eye's pupil closes, that's called an indirect pupillary reflex, and that's a sign that everything internally is working properly as well. This is called an otoscope, and it moves us to the next phase of our exam. This is where we're looking in her ear. And of course, what we're looking for is ear mites. We're also looking for any sign of infection or any abnormalities. And of course, most kitties will try and scratch with their little rear paws when you're doing that too, which is also a good sign, a sign that everything neurologically is working normally. Her ears are clean, which is fantastic. Still haven't finished with the head yet. The last thing we want to do is look in the mouth. This is very important. Your veterinarian always needs to look into the mouth of your new kitten because we're looking for evidence of a cleft palate. That's where there's a tiny little hole between the hard palate and the nose. It's a sign of an underlying birth defect. Her hard palate is intact, which is good. We're also inspecting her bite. We're also seeing if the tongue and the tonsils are in good shape, and they are. So, clean bill of health so far. So that moves us on to the rest of her physical exam. At this point, I'm going to ask Joelle to turn her around so I can approach her from the back end, which is the best way for me to listen to her heart properly. What I'm doing here is I'm listening to the heart and also listening to the way she breathes, making sure there's no evidence of lung congestion, making sure there's no respiratory infection, which there is not, which is really good news. So you see, all along during a physical exam, I'm basically looking at developmental abnormalities, checking here for whether her little umbilical cord was severed correctly, making sure there's no hernia, making sure there's no inguinal hernia, making sure that her hair is growing smoothly, there's no evidence of any dermatological problems. Ringworm, mange are two examples of that. And finally, just a quick palpation back here, make sure that she's not constipated, make sure that she's not blocked in any way, and make sure she doesn't have any developmental abnormalities in the back end at all. Finally, of course, after we're done, it's a lot of fun to just quickly have a look and see how she interacts with this little toy. This is something we'll give you to take home. The nicest part of any visit is freebies, so we make sure your kitty has freebies in the form of a little toy. We give you a month's supply of a very excellent product called Revolution, which is an anti-flea, anti-heartworm, anti-parasitic product you give your cat monthly. We can tell you more about that when you come in. And also, one of our nurses goes through various things you need to learn about your kitty. That includes vaccine protocols, also how to look after your kitty, how you feed your kitty, how important spaying and neutering is, of course, very, very important. Make sure your pet is always spayed or neutered. I've just lost my patient onto the floor. And finally, a little bit about parasites and behavior. Lots of information, of course. We always invite you to ask questions. But the most important thing here at Sable Chase Animal Clinic is that you learn everything you need to learn about looking after your kitty and make sure he or she has a nice long life. So come on in, bring your kitty, and we'll talk to you about her and let you introduce us. Thank you.